in 1975, I realised that up to half the patients in the intensive care unit were there because they'd been harmed by the healthcare process itself rather than an underlying disease or injury. There appeared to be no recognition of this problem and no systemic response to it. So finally I got frustrated, and in 1987 I woke up one morning and called 65 influential anaesthetists around the country and invited them to a meeting at Flinders Medical Centre to set national standards for safety. 5 things came out of that meeting. Firstly, we set standards for safety for anaesthesia and intensive care for Australia and New Zealand, which subsequently went on to become international standards. Secondly, we established the first not-for-profit patient safety organisation in the world. Thirdly, we set up a national incident reporting study. Fourthly, we set up crisis management algorithms for any crisis under anaesthesia. And finally, we decided if we were going to do research, we'd do it at a national level, because there's not much point in knowing how a particular condition is handled by a particular clinician in a particular teaching hospital when you've got a universal healthcare system.
To actually have the sort of complexities that we have in the healthcare system with each kind of patient interaction, with each technology, there's an awful lot that can go wrong. And prior to Bill coming on the scene, we didn't have a sense of how wrong, what might be actually working in this situation, and we didn't even record it to any great length. So I think his work has really changed the shape of the way we report and think about. We have data that we can actually look at. We can see how much, how often, when, what things might be actually playing into these sorts of errors. I don't think he would ever claim that he has actually changed the shape of medicine as it's practiced or the way we report safety issues, but he has. Okay, so he's been a leader, he's put himself out there. Yes, there's been people working alongside him, but if you look at his actual history of what he's been asked to chair, what he's been asked to lead, he's been very much driving this for the latter part of his career.